former White House Economic Council Director Larry Summers skewering Medicaid revisions in Donald Trump's big, beautiful bill. After helping make similar cuts during the Clinton administration on this thing called welfare, he even wrote an op-ed for the New York Times last week saying the cuts made him ashamed of my country as the left continues to hammer at the law's Medicaid provisions.
The work requirements are a ruse. What they're doing is they're doubling the paperwork on everyone, not just able-bodied adults, but everyone. What they're hoping is sadly, is that parents with a special needs child who are really busy don't check a box.
It doesn't surprise me that that Trump's crew are trying to change the subject as quickly as possible. But we're talking about 14 million Americans being thrown completely off of their Medicaid coverage.
Well, where's the truth? Joining us right now is the administrator for the Centers for Medicare and Medicaid Services, Dr. Mehmet Oz. Dr. Oz, great to see you. I wanted you to answer that directly. What about their statements was correct?
Nothing that I can tell. And I'm on the inside. So I've been studying this issue carefully. The president from day one said he wants to love and cherish Medicaid. Now, what is Medicaid? As you enter into the building where I work with Bobby Kennedy and other leaders at Health and Human Services, there's a quote on the side of the wall. It's from Hubert Humphrey. And it says, "It is the moral obligation of government," and we honor this, "to take care of those at the dawn of their life, the children, those at the twilight of their life, the elderly, and those living in the shadows." Folks with handicaps. Originally, it was called blind, disabled. So those are the populations Medicaid was designed for. 60 years ago this month, by the way, it's having its birthday. And it's the backbone of the social support system, the safety net system of the country. We have to keep it viable. And what happened over the last few years is a complete perversion of that mission, a destruction of its core purpose that led to its being at risk of bankruptcy. We would have spent $5.4 trillion more dollars instead of the $200 billion that we actually did put into it. So I'll say that again. We would have put a ton of money into it that would have bankrupted the system. Instead, we wisely put more money in, $200 billion. But then went one step further, and under the president's guidance, we actually fixed the fraud, waste, and abuse, specifically work requirements, which is what they're talking about. When the program was created 60 years ago, it never dawned on anyone that you would take able-bodied individuals who could work and put them on Medicaid. Today, the average able-bodied person on Medicaid, it doesn't work, they watch 6.1 hours of television or just hang out. That's not fair.
It's not okay.
No, go out and try to get a job. They argue that we can't do it. They're arguing against the competency of the American people and their government. I would make the argument that if I offer you a deal, I'll give you free health insurance, but you got to get off your tail and go try to go to work, you'll take the deal. Most Americans have already done that. Yeah. And they will continue to do that.
Dr. Oz, you have 80 hours a month volunteering school or job training for ages up to 64, able-bodied, twice yearly eligibility reviews. You want to make sure that you're still eligible. So you check in once or twice a year to make sure you're still doing it. No work requirements for people who are pregnant, caregivers for children under 13, disabled, or seniors. But some of the quotes are just unbelievable. You will kill, Larry Summers, you're going to kill 100,000 Americans. This is the most significant cut to social safety net in American history.
We already have pilots going in 2 states to prove that on your phone, 91% of people on Medicaid have a smartphone. You can just quickly point out where you're trying to work, what you've already done, where you volunteered, what kind of education you've gotten. We are attacking the $14 billion stolen from the American taxpayer because people don't tell you where they work and what they're doing, so they sign up for Medicaid in multiple states. And by the way, what we really wanted to do was to align the president with the governors. If we're creating a social safety net for the country, they have to be working together. The current system encourages governors to game the system. Don't tell anybody that you've got extra people on the roll who actually live in a different state.
And why? Because it's not state money. It is federal money. It's not my money anyway.
And then you have things like illegal immigration coming in. California takes money, pays for illegal immigrants, and then people in Mississippi and Virginia are paying extra federal taxes to compensate for that. We're saying, no, you're done with that. No illegal immigrants. We're not going to pay for gender care. We're not going to do all the things that we believe are undermining the very core deal you have with the states.
But I just think it's important for you guys to get your message out now. For the longest time, it's pass it. Now it's to explain it. So
I am proud of the people on Capitol Hill, the senators and congressmen who bravely took the right decision to save Medicaid, because that's what they did with the one big, beautiful bill.
And I want you to save some of your A game for radio later. You're going to join me.
I'm here. I'll be with Brian
Dr. Oz,
all day.
Thank you very much. I know.
I'm Steve Doocy.
I'm Brian Kilmeade.
And I'm Ainsley Earhart. And click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis.